much.
Oh, it's lovely to have you here, and lovely to be speaking to you on this rather grey Wednesday afternoon.
Yes,
But there you go. But it's lovely to, and we're zooming. We're
we are
not,
zooming.
yeah, we're not sitting.
Everybody is
Well,
zooming.
indeed, we're not sitting in the same room, are we? Good grief! What can I say? Anyway, Jane, you are. Can I call you the CEO?
That's one of my many titles.
Yes. Okay. So you're the CEO of an organisation called Orb8, and on this particular podcast, Social Worker Matters, I'd like to sort of interview folk who are doing sort of extraordinary things, not just conventional things. And I consider the fact that you stepped out and sort of formed this organisation of your own. I consider that to be extraordinary. So can you sort of share with our listeners a bit about who Jane Hurd is, and why it was that you set this thing up?
Okay, well, I've been in social care all my working life, really. So that's giving my age away, well over 30 years now. And as I qualified social worker about 25 now. I know when you start having these conversations,
I know.
people start doing the maths. But yeah, so and I very much see myself as a social worker to my soul, or very much that's who I am.
Mm-hmm.
And but I would call myself a clinical social worker, which we don't tend to use that language much in this country. Do a lot more in Europe or America, but not so much in this country, which means that I'm therapeutically and informed, particularly interested in mental health and well-being of children and young people.
Right.
And have been for a long time. So I did the standard sort of social worky childcare things when I pre-qualified and initially qualified, but very quickly went into children's mental health. And then through that have developed a particular interest in what I was calling then hard to reach, adolescents in particular. Now I would more call them traumatized young people, children and young people. So that's who I'm particularly interested in. I did my doctorate in looking at what I was calling then hard to reach adolescents at the Tavistock and Portman. And I'd already, I think, gone independent by then. And actually, social work doesn't exist in CAMHS anymore. I'm not aware it does at the Tavistock and Portman, actually, but I'm not aware anywhere else nationally. There may be one or two patches, but I was in Essex for a long while, and my post doesn't exist anymore.
Can I just pause you for a second there, Jane? For people who may be listening who are not kind of so familiar with our acronyms, can you just explain what CAMHS is?
Apologies, absolutely.
No
Sorry.
worries.
So CAMHS is Child and Adolescent Mental Health Services.
Mm-hmm.
So they're a primarily health-run organisation that and CAMHS teams, Child and Adolescent Mental Health teams, were traditionally multi-agency and multi-professional. So they had people from health, allied professions. So they had like psychology, psychotherapy, and traditionally social work.
Right.
And I was in a clinic close to 15 years, I think.
Wow.
And there was a long history before me of social workers in clinics. And my post, I had left, I must have had my sort of intuition might have been, because I left and within 2 years my post and anybody social work posts were pulled by social care, partly I think because of budgetary constraints. So and generally and I'm aware that they had gone from a lot of clinics, a lot of children's mental health services before then. So actually
and in a sense that's quite important, because I'm just thinking about some students who may be at the end of their training at this point and may not necessarily want to work in the statutory local authority kind of setup. But what you've just described there means there's one less door open to them in terms of therapeutic social work.
Absolutely. I think a lot of family centres, Sure Start children's centres have gone, um, uh, roles within sort of child and adolescent mental health services. I think some organisations, it's a bit complicated now because rather than having teams, they have sort of what they call tier 2 services, so individual practitioners, and occasionally individual practitioners might be social workers.
Right.
But I don't quite know where you'd get the training. You'd have to do an additional training.
Yes.
My training was I do have a counselling training, but my training was primarily being in a clinic with very experienced people for a long time. So yes, it's another, and I did always feel it was somewhere that you could go if you were therapeutically inclined. You could do social work, and it was social work, but it was what I call early clinical social work,
right,
therapeutically informed social work. And I think you're right. There's less and less places, particularly in this, the public sector. There might be opportunities, and we'll go on to this. Is why I'm in the sort of.
Well, yes, I'm now thinking. Well, is this what drove you to sort of branch out on your own and do your thing?
Well, yes, because I'm aware it can be controversial in social work. The private sector, people are quite suspicious of. They see it as out for sort of financial gain and undermining sort of public services, and there is some of that going on. There are big players, in things like residential care and foster care, who are hoovering up a lot of money, and with a variety of services, so the very good to the not great, so that but there seems an overall sort of lack of comfort with social workers going into the private sector. But I don't know where else I would be. I suppose it's possible, and I did work in education for a while. I have worked in the third sector, but then you get in this quite, I think, difficult position that if you're in a charity and then charging people for services, then you're just a business with who can take donations.
Yes.
I'm not terribly, so that's why I didn't go down that route, because I just felt actually it was disingenuous to say, oh, we're a charity and we're going to charge you to provide you with a service. And like, well, what makes you a charity then? And it is that I can, in addition to charging you, I have a donation as well. And I felt because we were actually providing a service that would be paid for, that it needed to be down a business route. But I am what's called a social enterprise, which means
okay, so let me pause you again, because I think we missed a trick there.
Okay.
We're now moving into Orb 8.
I have moved quite quickly.
Yes, you've moved. You're a mover. So we're drifting towards Orb 8.
We are.
So before we sort of go into the meat and potatoes, as they say, tell us a bit about Orb 8, what it's about, and et cetera, and then
okay. So as I say, I set it up. Well, I set it up because I am passionate about the needs of traumatized children and young people who are in the social care sector. Primarily, that's who I deal with, because that's my background, but also in the health, refugee and asylum seeking children we do some work with, education, health, criminal justice, obviously, where there is beginning to be some understanding by some practitioners of the importance of neurodevelopment and trauma, but it's pretty patchy, pretty limited. It's generally not core to anybody's training, whether that's education, health, social care, social work. There are practitioners like me who've found out about it, found it really interesting, and have done our own work, really.
Yes.
So it's pretty patchy, and I think it's really important. I think children in the social care sector, special education, criminal justice. A lot of them have trauma backgrounds. And that isn't recognised, often because that happens very early, and then people don't realise that that is significant. That has laid down the playing field for the rest of that child's childhood, unless you actively intervene in that.
Right.
And people often don't realise that. And they also, even if they don't realise it, they're not really equipped or skilled or have the knowledge and training to know quite what to do about it.
Right.
So that's why I set up Albeit, with the intention of trying to address the needs of traumatised children and young people in a variety of settings, primarily, as I say, social care, because of my background as a social worker. Right. So that's where Albeit came from.
So you were sort of beginning to tell us a bit about the entity itself, and tell us a bit about that. Why did you not go down the strictly private route?
Just because, I was saying that social workers feel uncomfortable about private enterprise and profit in.
Some do.
Well, some do. Yeah, some do. Yeah. And myself, I suppose I'm including myself in that. I didn't feel particularly comfortable in that world.
Right.
And when I discovered social enterprises, that's a sort of middle position, because I'm still a limited company. So I'm still a business that sells a product, which is training or counselling or psychoeducation to various organisations. But by saying we're a social enterprise, we have to keep to various rules around profit and purpose and inclusivity and equality and things that are important to me. So it means that I suppose I am having my cake and eat it, but I think one can genuinely do that. So that's why we ended up as a social enterprise.
All right, brilliant. So it sort of resonates with your values. Excellent. Does. So, I mean, you gave us a bit of a run through about what it is you offer. Do you want to say any more about that? Because I kind of you missed out, it seems, the bit you do with foster carers. You didn't mention that.
Okay. Well, so what we do, it's interesting. We've only been going 2-3 years, and we're working it out as we go along, what people want, where, and we're talking in business language, where the gaps in the market are.
Right.
And what works best. So we started off thinking we'd do more direct work with children and young people.
Right.
I work on what's called an associate model. So this is partly about sort of being lean and mean and not, trying not to charge people any more than we need to. So we don't have an office. I don't have a secretary. I have an admin person who does a few hours a week. But and I don't employ anybody. I have associates and that also means a kind of a wide range of expertise, and then I call upon them and pay them for that particular piece of work they do.
Good model. Good model.
I think I would encourage people, if people are going down that route, either to look at an associate model or maybe a cooperative model, if there's say 2 or 3 of you want to do it together, something like that. Because, again, that's keeping within our values. We're not about creating great big entities. We're about doing something that's useful as efficiently as possible. So that's the model. And we did start by thinking we would see more children directly, but that's quite complicated because kids are all over the place and my associates are all over the place. And then we didn't want to charge for travelling time and, so it just got quite tricky. And then what we were asked to do was, I suppose, 2 central things. One is reflective practice groups, which I know you're also interested in.
Yeah.
So that's a particular sort of way of being together, maybe for a senior staff group, or we have also done some work with what we call whole system reflective practice models where we're supporting staff sort of with the emotional load and the thinking therapeutically about the children they're working with. One of the things we understand, if you're working with traumatized children, that can be quite tough. So that's one of the things we've developed. We've developed, particularly, you're quite round around foster carers, because that's where a lot of the interest has been, around therapeutic foster care and the development of therapeutic skills. So I've written a therapeutic foster care training based on a particular model I've developed, and what this is the learning as you go along. I realised actually that unless you're quite experienced, that's probably not an entry-level course. So I've also done an introductory sort of package now of that can fit in with support, foster care support sessions. So you also have a reflective practice group and a sort of a bit of a reading and a bit of discussion together. So so that's what we were very much sort of pushing the training thing and developing packages with various providers and also doing.
I was just thinking the other thing is probably quite great is that you probably have a much larger reach. I mean, obviously that wouldn't have been your sole motivation for doing it, but then when you think about international work, and I know that you've spoken in international arenas too.
Yeah.
The training piece and education piece is something that is a lot more leverageable in terms of getting the word out, so to speak. Do you want to say a bit about your international?
Oh, I could say something about. So yes, when we started, again, we thought about delivering quite locally. However, we delivered a reflective practice project in the northwest of the country. We got a lot of interest at the moment in the Midlands.
Right.
And I'm not quite sure, I'm never quite sure how people find out about us, but it's great. And also somebody who's in the Midlands who's also got providers in the sort of far sort of northeast of the country. I've been to the Isle of Wight, which was very nice.
Ooh, all right.
But it's not quite international. I've also been to Mexico, which was fabulous.
Yes.
I have to say.
That's what I was talking about, lady.
I know you were talking about that. And I was I had a Zoom meeting yesterday with a Mexican charity who were the people who post me, and we're interested in trying to create some sort of project and go for a grant so I could go over there and do some training with them. They're also interested in policy development, which isn't so much my sort of thing, but I, you know, having been around a while, I do know someone who might be able to be helpful.
Someone who knows someone.
I know someone, So
the interest around the model that you've developed?
Well, in Mexico, in Mexico, fostering is very new. They've only had legislation in the last 5 years.
Oh, wow. Okay.
It's very new as a concept. People generally, and I can say this because the Mexican people I was speaking to last night said this, people don't generally understand the difference between adoption and fostering.
Right.
There tends to be a preference for adoption. And fostering is very new. There's a few small initiatives, and they've done a couple of small pilots, and they are in discussion with the government about further development. And so we're having a series of conversations of working out what would be helpful,
right?
Because I suspect my quite, almost want to call it elaborate, but quite developed training course, particularly therapeutic foster carers, is probably not what they need at the moment. So it's having a series of conversations to try and work out actually what they need.
Where to pitch it.
We're talking about, they were interested in maybe us doing a series of webinars to their networks in Mexico, which could be 500 or 600 people a time. Wow. I was thinking, oh my goodness, okay.
Oh. Go girl.
Yes.
Oh my gosh, yes.
So, to try and get some of the basic ideas around foster care and attachment and sort of not so much therapeutic foster care, but relationship-based care and what that might look like, and also creating some sort of structure, because at the moment they don't really have a structure of training or support for foster carers because it's very new and they're just trying to work it out. So yeah, that's something.
I mean, I do think these things are interesting, because you'd said earlier that you're learning as you go along.
I absolutely am.
And I guess, you know, for some of us who are in the sort of independent space, we probably tend to think of, well, this is what we offer, like it or lump it. But what you're describing is a scenario where you're kind of being quite developmental, and I mean, I think that's really, really exciting.
Yeah, and we're also running a what has become a Zoom conference on June the 3rd on therapeutic foster care, with partners, the Mulberry Bush and also the National Association for Fostering Providers. And I'm only mentioning that because we had a message from a Portuguese agency saying, can we please,
lovely.
Can we Zoom in 10? So we've got 10 Portuguese people.
Oh, excellent, excellent.
So
you know, who would have thought? I'm sure had this not happened, you probably wouldn't be thinking of those stuff.
We wouldn't have done a Zoom conference, and we got 70 people coming. And
wow.
Oh, and yeah, we still got a couple of weeks of booking. So you know, and talking about being developmental, I think the whole Zoom, well, we'll call it video conferencing, but I am, you know, different people using different platforms. But the whole, that has really changed my thinking about things, because, as I say, one of the difficulties about doing individual work with carers is they're all over the place. And by the time you get there and you do a piece of work and you come home, it's actually not financially viable either for the organisation or for us. And I was
and your sort of physical well-being. Let's put that out there too, because traveling is such a nightmare.
Yeah. So an organisation contacted me at the beginning of Corona and said, could you do some you know, video conferencing stuff with our carers? And I thought, could I?
Of course you could.
Well, yes. We can't offer them anything else at the moment. It was an organisation we were doing ongoing training, but we can't offer them anything else at the moment. So we'll give it a try. And actually, I've sort of been caught myself out. Caught out my own prejudice about it, because I wouldn't have done it in any other situation. I have done it and it works really well. What I would say works really well is what I call psychoeducation. Like, my kid is doing this odd thing, and I'll go, oh, that's interesting. What was happening beforehand? What's their history? What do you know about them? What might they be saying through this behaviour? You know, and we'll have a conversation, and by the end, most of the time, we've come up with a bit of a better understanding. The foster carer perhaps feels a bit less anxious or cross or whatever they're feeling, and they also might have a few ideas about, oh, well, I'll go away and maybe deal with it this way, or think about it this way.
There is certainly something about this way of doing things. I mean, I guess there's lots of learning and lots of stuff will come out, but there's definitely something about doing things this way that I don't think we can be too dismissive of.
Yeah,
so
absolutely.
That's fabulous. Yeah,
absolutely. So, you know, in the developmental thing, I would certainly be up for offering more of that. And two things seem to work fairly well. Psychoeducation, I've also sort of, for people who are this sort of traumatic situation of us all living, you know, with our mortality hanging over us,
yes.
You know, and with lack of family support and all sorts of things. You know, for some people, it's really brought up their own trauma and their own difficulties. So, along with psychoeducation, I'm also doing, I don't know what I call it, but sort of not quite counselling, but support sessions.
Yeah, some relational something or other.
Emotionally overwhelmed by things.
Yeah.
And it's just helpful to talk about.
Yeah.
And so that's the other thing that's come out of, well, I'll see what I can do on Zoom. One is, as I say, psychoeducation works really well, and what I call emotional support And all these things are just aspects of social work, or certainly clinical social work. So,
Yes. Yeah.
but they're things that seem to work pretty well on Zoom. Yeah, so
that sounds fabulous. It's giving me a few ideas as well.
Yeah.
Okay, well, we're the time is fast moving on, and Jane, I
Yeah.
really wanted to get to, perhaps you can share with us what you feel, or where you feel Orbate would be going in the future. What I know you don't have a crystal ball.
Well, you know, I was pleased what you said earlier about often people who are independent say, I do this. And actually, we have been a lot more flexible. So the honest answer to that is I'm not quite sure. We do seem to have international interests, which I'm looking to develop. We seem to have interests. You know, we have shown, I think, that using of sort of video conferencing does work quite well. So I would be really keen on developing that, just because it means that we can spread our expertise sort of wider.
Well, yeah. I mean, I'm thinking about the contacts I have in the Caribbean, and you know, this would be a great medium for them, and they're always dealing with things around trauma, you know, sort of international disasters and so on. So coming together with some folk where they wouldn't need to then think about having to travel and this kind of thing, it just opens things up for sort of cross fertilization and learning. So I think it's fantastic.
Absolutely. And I was also talking to somebody, a foster carer who's looking after a child who might end up going abroad to be looked after, and I was thinking we could follow him. You know, the person it's not me who's doing the therapeutic work, but one of my associates.
It's all possible now, isn't it?
And it's like, gosh, that's so exciting. He'd have someone who knew about him and how he was in a family who could follow him on Zoom.
Wow.
You know,
that's
so
fantastic.
I am very pro real people and meeting with real people. You know, I'm missing real people. I'm not advocating that we all stay in our houses forever and not see anybody.
I hope not.
Because I miss real people. However, I think this has, certainly for me, and I don't think I'm alone, brought us up to the potential of sort of digital media, and that we could do a lot more with it. I would say I think training is quite difficult. It's quite, because it's quite hard to keep your attention, I think, for more than about 45 minutes. Medium. So I think our training staff would have to be person to person. So that's a bit on the back burner at the moment, but that's fine, because that's allowed other things to develop.
So you definitely see part of the future, including initiatives like this kind of medium. I mean, in terms of your sort of events coming up, is there anything that you'd want to share? Is there anything you could share in terms of where people could find out more about Orbate, yourself, and so on? Any links?
Yeah, well, we've got a website. So it's orbate.org, which is really easy. And on there's we've got a special sort of COVID section now about the sorts of stuff we're doing in that respect, which includes the upcoming trainings and things.
I'll put all those details in the show
so
notes,
that's
definitely.
Probably the best place for people to start. I'm very easy to get. Again, it's easy, Jane at Orbate, which is orb8.org. So they're probably the best places for people to start.
Okay. Do you have any publications out or anything that people can access?
I am part of the International Centre for Therapeutic Care, which people might be interested in. And that is free to join via the Mulberry Bush School. They host it. And I've written a few short papers on my hard to reach research, and also my model of therapeutic foster care on there. I'm also a member of the IRCT, which is What does that stand for? Something for recovery from childhood trauma.
Right. Well, I'll definitely
Recovery
get
from
an email
Childhood
from
Trauma.
you afterwards, and you can put all
Yeah.
this out so I can put
Because
that in
there's
the shortlist.
you do have to join that, but it's
Okay.
quite reasonable. There's some things you can access without joining. But I did a talk at the House of Lords for them, which was very good for my ego. And and there's a PowerPoint from that on the IRCT website.
Oh, brilliant, brilliant, brilliant. So we'll get all those details from you and put them on the show notes.
Okay.
Okay, so Jane, time is moving on. This is a Zoom call, so it won't last forever. Is there anything that we've talked about or haven't talked about that you think you'd like to leave us with in terms of thoughts?
I just think it's something about being adventurous, really.
Yeah.
You know, when I had a very nice job that I liked. I was a bit bored, but it was a very nice job and I liked, and a nice team of people, and you know, and to jump ship and initially go independent and then set up a business, and you know, people still look at me like I'm slightly strange, but it's like it's just lots more possibilities.
Think outside of the box. I'm so glad you ended with that, because there's so many of us who are either fearful or just don't want to do something different.
And I'm very happy to talk to anybody, whatever their particular thing. If they think, oh, I'd like to do something, maybe independent, want to know about social enterprises, very happy to talk to people.
Lovely. Well, Jane Hurd, Dr. Jane Hurd, thank you so much for spending some time with us today. It's been an absolute pleasure.
Well, thank you for inviting me, Sylvia.
No worries.
Good to talk.
Yeah, and can you promise to come back at some future point if, let's say, there's a hot issue that we need your view on?
Yeah, sure. I'd be very. You know, because I haven't done this before, I was quite nervous, but it's fine. And so, yes, if there's something...
You didn't seem nervous.
Oh, well, I was before. I'm quite good at talking, so once I start talking, I'm all right.
It just melts away.
It does. I do like chatting.
Lovely.
So, yeah, if there's something that I can be useful in respect of, I'd be very happy to join you again. And thank you very much.
Thank you very much, Jane. It was an absolute pleasure speaking with you.
Okay, all right, bye.
Bye-bye.